Hello, everybody. We welcome you to this edition of News You Can Use. I'm your host, Thera Martin Milling, and glad to be with you one more time. Today on the program, in the first segment, we're going to talk about something very, very important, kind of serious too, but it's about the Obamacare health plan and enrolling. Now is enrollment time, and we want to help you through that maze. So I've got an expert here to tell us all about it. We will be talking with Mr. Neil Deegan. He is with the Enrollment America's PA State Director of Obama Healthcare. And then a little bit later on, when we turn the page on this edition of News You Can Use, we're going to talk about addiction recovery a little bit. We've got two very special guests who will join us in the studio who are willing to share just a little bit of their personal story to maybe encourage you. If you're using, if you want to be clean, if you want to be drug-free or alcohol-free, they're going to tell you the steps that they've taken to get there. So stay along for the ride as we continue with News You Can Use in just a moment. Hello, everybody, and welcome to this edition of News You Can Use. I'm your host, Thera Martin Milling, and sitting by my side, Mr. Neil Deegan. We thank you for joining us today.
Thanks for having me.
Thank you for coming. We appreciate it so much. And you are the State Director for the Obama Healthcare Insurance Rollout.
Well, so I'm the State Director for a group called Enroll America.
Okay.
So Enroll America is a nonprofit, nonpartisan organization. Our goal is to connect people who are uninsured with the resources and information they need to get covered.
Wow. Okay, so let me just start by telling my viewing audience, I am one of the people who is a recipient of Obama Healthcare. First signed up when the enrollment period started back in 2014. Now, wipe those shocked looks off of your faces, folks. Some people happen to think that I make a lot of money and I'm, like this big person with all this stuff, but not so true. A lot of the things that people may see me do, it's a volunteer situation, but I'm still thankful. I'm thankful for all the opportunities that I have. And I do have a job, a good job, working in North Philadelphia as the North 22nd Street Business Corridor Manager. It happens to not be a full-time job. It's 32 hours a week, so I'm right there. I don't get the health insurance, but thank God, I thank God for Obama Healthcare because I do get health insurance on my own. So when I first signed up, I was one of those grumpy individuals who didn't believe in it. I thought it was going to be expensive. I was afraid. I was concerned about, can I afford it? I was so concerned. And I'm telling you, I waited till the last day, the 11th hour, back in 2014, March of 2014, I remember the date, March 31st was the deadline to sign up, and that's when I signed up.
That's when a lot of people signed up.
And when I signed up, there was a wonderful insurance navigator who sat there with me on the computer, and she was so caring, and she took time with me. She was wonderful, and we got through it. And at the end of it all, I'll even tell y'all what I was paying, $45
Yeah, it's incredible.
a month for health insurance.
That's the point I think that's most important. So a lot of folks who maybe they've heard over the last couple of years that, this affordable health care is available, that it's easy to sign up, that it's affordable, and they think, well, what does affordable mean? Affordable to you isn't affordable to me. I don't have room in my budget for that. The fact of the matter is there are a lot of folks just like you who are paying $30, $40, $50 a month, and it really is affordable. Affordable is a relative term, but for most folks, we're really talking about something that can fit.
Now, when I got a little bit of an increase in my pay, and I had to report that.
Right.
And then it was adjusted a little bit, so it ended up being a bit more, but still affordable for me. Thank you. I was so, so very glad. And I have health insurance. When I had gone without health insurance for almost 3 years, as I had not gotten back a full-time job, one full-time job. So I got a bunch of little part-time jobs, and it's okay.
A lot of people
We're going to
do.
be all right, so yeah.
Well, and that's, a lot of folks don't have the traditional 40-hour-a-week job, just like not everybody stays at the same employer for 30 years. The economy is different than it used to be. And so for folks that are maybe self-employed, for folks who are maybe doing a couple of different jobs part-time, this is something that means a lot for them. It used to be that the only way you could get health insurance was if you got it through your 40-hour-a-week employer. And that also meant that some folks were tied to that. Some folks would say, well, I would really like to go out on my own and try to do something a little different, but I can't because I can't leave the job that provides my health insurance. So not only does this help folks that didn't have health insurance to get health insurance, but it gives folks the flexibility to go out and try something new. You know, they're not tied to a job because of their health insurance, which is such a big deal.
Right, absolutely. Well, I can think of a few people that were pretty close to me who were miserable at their jobs, but they had a full-time job, they had great health coverage, and so they stayed for that, but they hated their jobs, they were miserable. So this does give you another way out.
That's right.
What should people expect as they come to, well, you can do it online for yourself.
You can. So the first thing is you can go to healthcare.gov. There was a lot of, during that first enrollment period, you probably heard a lot about it because there were problems with the website. It was the first time around, things are tricky. I'll tell you the truth. My mother, who is, needed help signing up, she called me one day and said, "This website doesn't work." And we figured it out, and she got signed up and got covered for a pretty good price herself. And the website is also a lot easier than it used to be to use. But what we have found, one of the things that Enroll America does a lot of is data gathering and analysis. You're 60% more likely to complete the process of getting enrolled if you come out and meet with an enrollment assister. So just as what you said, you came out, you sat down with one of the navigators at an event. They walked you through the process. They helped you identify, helped you to sort of identify.
The best plan for me.
Exactly. They don't tell you what's the right plan for you, but they help you to to figure out what that is for you. And so you're more than twice as likely to finish signing up if you work with somebody like that. Those counselors are all over the city. And in fact, we have a website, really easy to use, gcaconnector.org, where you can put in your zip code and find an appointment in your community, sign up, go, usually takes about an hour. And it's easy, it's done.
Do you need to take any substantiating information with you to prove?
You really should. So your social security number, which most folks, remember or have, and if there are other folks in your household that are signing up, so if it's, you and your husband, or you, your husband and a kid, or some other family situation, you would want to have their information, your income information. If you have a special immigration status, you would want to bring documentation around that as well, because that can have some impact on what you're eligible for. Those are the basics that you should bring with you. And again, it's you want to be prepared to be there for an hour, maybe a little bit more, to go through the whole process and be really thoughtful about it, so that you can make that best decision for you and your family.
Okay, all right. And then again, people should be prepared for the time factor. Bring your proof of income and social security number. You should have that. And I guess be prepared to think about what health insurance you want to get, because I ended up with Blue Cross Blue Shield, which I'm happy as I can be, because I had Blue Cross Blue Shield when I had a full-time job and I was a senior manager and I had the title in the office and all that, and I had it. And now, these years later, I still got Blue Cross Blue Shield. Little different situation, but I'm happy.
Yeah, and that's what I had last year when I was on Obamacare too. And the other thing I'll say, and this is so one of the challenges that I think we did face over the last couple of years is it was tough for folks to find information about the plans before they came out to an appointment. There are a lot of ways now, and we have one of these ways on our website, where you can actually look at the plans that are available. You can get kind of an estimate of what the cost is going to be to you. Not just your monthly premium, but if you have high blood pressure, maybe you have to have a couple lab tests every year. You have to go in for maybe not one checkup a year, but 2 or 3 checkups a year. You can put that information in and it'll say, well, this is, these are the plans that would make sense, for you in terms of what your out-of-pocket cost would be and all that. Again, not making a recommendation about what plan you should select, but giving you the information about, well, this with a deductible would cost you this much a year. So folks can, and that's at getcoveredamerica.org, folks can take a look at that before they come to their appointment and bring a printout and say, these are the plans I was looking at based on some of my health conditions. I'd like to maybe think about these. And the navigator or in-person assister can help you to sign up.
Okay, so enrollment period for Obamacare and for Medicaid, it just hit November 14th or something.
November 1st.
November 1st, okay.
So it's November 1st through January 31st for marketplace coverage, so through healthcare.gov. Now, there is, not so new anymore, but at the beginning of this year, the expanded Medicaid program began in Pennsylvania. Now, this is a huge shift because even in 2013 and 14, when Obamacare first came onto the scene, there wasn't an opportunity. If you made less than a certain amount of money, there wasn't really an opportunity for you to get covered. Now for folks, for a single person making less than about $16,500 per year, more for families, there's an opportunity to get coverage for free with very low co-pays and things like that. And that is actually open all year. This is the open enrollment period. We really think that people should come out. We encourage folks to come out now, meet with an in-person assister, find out what's available to you, but there are options for everybody. There's no reason for anybody to remain uninsured at this point.
Okay, so now for people who signed up when it first came out in 2014, is it absolutely necessary that they re-up, or are you automatically in there and you don't have to worry about it?
So if your plan doesn't change, it auto-renews. But, and this is based on some other research, every year new plans come on the scene, and plans may change a little bit. And so what we encourage everybody to do is to come back, either go into healthcare.gov or meet with an enrollment assister, because even if your situation hasn't changed and even if your plan hasn't changed, there may actually be a plan that better fits your needs that might be a few bucks less a month. You get coverage that's better for you, save a couple dollars a month. We encourage everybody to come back through.
Okay, so it's beneficial.
But that you have to do by December 15th.
Okay. Now, for the stubborn, hard-headed individual who just says, I don't care about my health, and I don't want any health insurance, you're going to be in trouble with the IRS,
yes,
right?
Yes, ma'am. Yeah.
I mean,
so, and I would appeal specifically, so half of the folks in the country who are uninsured and have chosen not to sign up are 18 to 34, so young people. If you don't have insurance this year during 2015, when you go to pay your taxes early next year, you're going to get hit very likely $325, or 2% of your annual income, whichever is higher. That's a lot of money. Last year, if you didn't have insurance, you paid a $95 fine, which if you get a tax refund, you may not have noticed. It gets worse because if you remain uninsured in 2016, when you go to pay your taxes, $695 or 2.5% of your annual income. So there are folks that felt as though $95 was preferable to paying the monthly premium. You're really taking a risk because if something happens, we were just talking about this. If you go out for a run and you break your leg, you're $20,000 out of your pocket.
Listen, give the website one more time. I'm being given the signal. We got to wrap it up, so give us that.
GetCoveredAmerica.org. You can make an appointment. You can find out more about plans, and we've got some great events coming up in the area, especially with the Benephili Enrollment Van.
Okay, I thank you so much for joining us and sharing that very important information.
Thank you for having me.
And folks, he will be back with me on radio at 900 AM WURD so we can continue encouraging people to get registered, get signed up for health care. It is so very important. We will keep it moving as we go forward. Going to turn the page now. We'll be back in a moment. And two ladies who are in recovery are going to share some of their story. Stay with us.
Nine out of 10 of us say we want to die at home. But for a third of us, this is the last place we'll see. If you had just months to live, where would you want to be? Willie wanted to enjoy her great-great-great-grandchildren. She chose hospice. See what's possible at momentsoflife.org.
The United States Air Force has a proud history of leading our nation in embracing diversity. We've been reaching new heights for years by understanding it's our individual experiences which make us strong. You can share in this success by seeking opportunities to learn and grow as a member of a diverse team. We are the world's greatest Air Force, not because of what we do, but who we are. This message is brought to you by the U.S. Air Force.
Well, here we are in our second segment of this edition of News You Can Use. If you just turned your television on, well, you missed the information about the Obama health care, but let me just tell you this. If you haven't signed up for health care yet, now's the time to do it. You have until January to get re-signed up for Obama health care. If you've not done it, make sure you handle your business, because otherwise the IRS is going to tag a price onto whatever your bill may be when it's time to do taxes, and you don't want that to happen, so make sure you check that out. In this segment, we have two wonderful young ladies who are here to share just a little bit of their personal stories to encourage people who want to be in recovery. I'm talking about alcohol and drug recovery. And so we're shining the spotlight on two young ladies who are from an organization that is very near and dear to my heart, that I've been a part of for the last 31 years, One Day at a Time, Drug and Alcohol Recovery and HIV/AIDS program. I've served as a member of their board of directors for about 28 of the last 30 years, 28 or 29, and certainly I'm always there whenever they need me. I love to be there for One Day at a Time, volunteering at their various events, and I'm always trying to share with people who want to get clean, who want to try a new way of life one day at a time, to come to ODAT and get some help if you need it. So thank you, both of you ladies, for being here. I have Mayetta with me, and I also have with me today Tamika, and I'm not going to use your last names to give you some sense of privacy. I appreciate you for being here today and willing to tell a little bit of your story. So let me start with you, Mayetta.
Okay.
You are 26 years old.
Yes.
And you're a part of One Day at a Time.
Yes.
How long have you been there?
I've been there now. I've been there 36 days,
Okay.
but I've been a part of ODAT. I live in the neighborhood. I have volunteered, some of the programs, the
You've seen them in
Thanksgiving and
action a
Christmas.
long time.
Yes,
Yeah,
So
yeah.
I've been in the neighborhood, and the program has been helping me before I even came to the recovery house. I struggled a little bit.
What drew you to, because crack was your drug of choice?
Crack and alcohol.
Okay.
Yes. So I started using, I came up pretty good. I lost my mother at a young age. A few years later, I lost my father. I started out smoking weed, and I thought it was fun. I did it right there on 16th of York, where I resided, and I was just around the wrong people at the wrong time. And I was 19 years old when I picked up crack, and it's been a struggle for me since. And I've been in and out of certain treatment programs, and it just.
I always hear that crack is like, when you smoke it that first time, it gets you?
Yes.
I always hear that.
It has got me, and I have never felt that feeling since I was 19. I have been chasing, and it just progressed so fast, and I didn't even know I was an addict. I didn't know I suffered with a disease. So when I come, I learned a little bit about what I suffer from.
Yes.
And I actually just had a baby. My baby is 27 days old today. And,
it's hard to believe, Mommy. It's hard to believe you just had a baby, Mommy.
Yes. So I was grateful when I left the hospital. I came straight to One Day at a Time. And it's just like the opportunities and the resources that they have, they've been helping me. They've been, on my side, with not just for me, for my kids. And like,
you have more than
I have
the
two
baby.
children. I have an
Okay.
8-year-old son. His name is Kasir, and I have a baby. His name is Nazik. And he's in the care with one of my closest
He's
friends.
with family, so
Yes.
that's a blessing.
Yes, it is a blessing.
Okay.
So
I guess the twist that I want you to say to our viewing audience, if there's a young lady or a young father who's watching right now and they're using crack or some other drug of choice, they have to understand that if you have a baby, and I guess nowadays the hospitals test
The babies.
Best
Yes, they
test
test
the
the
babies, and they
babies.
see a drug in the baby's bloodstream,
Right.
then they're not going to let that baby go home
Right.
with the parent,
at all.
until
No.
they
get
know
they-
that you are straight.
Right, absolutely. So I'm just saying, if it's anybody who need help, and I know if I can do it, and I can fight to get my baby back, and I know that they don't want my child, and I can continue to do what the program has to offer. I go to outpatient, I go to outreach, I got parenting classes. If an addict like me can stop using drugs, anybody could. And you know, even with my age range, I got goals. I want to go back to school, and they helping me with reach these goals.
Good,
I
good.
just, the love that I feel at the program, I have never felt, and I've been to a whole lot of other programs.
Nothing like
And
ODAT.
I'm willing
Nothing
to
like
be
ODAT.
with ODAT for life, just one day at a time.
One day at a time. That's
Yeah.
how you do it, and that's how you get cleaned up.
Right, and it
Yes.
feels good. And I'm
Yes.
grateful to have this opportunity. This is what recovery does.
Yeah.
I have never been on TV, so
Yeah,
I'm
tell your
grateful.
story, and hopefully it'll touch somebody else. Now, your story, a piece of your story, and how you got to ODAT, and what attracted you. What's your drug of choice?
Crack cocaine, PCP, marijuana, alcohol.
PCP, is that a pill?
No, that's wet.
Oh,
It's embalming fluid dipped in the cigarette dipped in embalming fluid.
you look
Yeah.
great for having had that stuff, because I've heard about that PCP thing. That
Right.
angel dust, it's angel
Yeah.
dust.
Yes.
That some people, when they use that one time, they're never the same again.
Right.
Embalming fluid?
Right.
Woo, you're a blessed young lady to be sitting there. You look like you have all your faculties together. You know who you are, what you are, and whose you are.
Yes.
And some people, when they mess with that PCP, which I know as angel dust, it is detrimental. Like never come back to yourself. Some people, when they have it one time, so you're a blessing.
Yes.
Let me rub that hand. Well, give me some of that blessing. Okay. Okay. So that was your drugs of choice. And then one day, what? You looked in the mirror and said, "Wait a minute, this ain't me. I'm sick and tired."
Well, what my experience was, I got locked up for using PCP, and it was mandatory that I get treatment for my drug use. But however, once I came into treatment, I began to work the program. You know, I had a desire to stop using drugs, like a desire to stop doing what I was doing. You know what I mean? So I put forth some effort to work the program.
Wonderful.
You know, and it tells you that you first have to, there is no requirement for membership, but a desire to stop
You don't have to
using.
come in rich when you come in
Right.
one day at a
Right.
time. You
You
don't
just
have to
have to
have
have a
money.
desire.
You don't have to drop $100 at the door. You can come with nothing but
Right.
the clothes on your back.
And that's
and
exactly
ODAT will help you.
what I came with, and they have been helping me from the day I got there. Is that, you know, a love. They care about people. You can feel the sincere that they
Right.
have in their hearts. You know, to reach out and
Yes.
just to help the still sick and suffering. And I'm just willing to do the same thing.
So now, like, just to give people an idea, because we got about 4 minutes
Okay.
of what to expect. If you turn yourself into ODAT, first thing, after they let you make a phone call to your loved one to say, I'm here, I'm trying to get recovery, I love you, I can't talk to you for 30 days. I'm going on what they call blackout.
Blackout,
Right.
right? And that's the piece that you get to get in touch with yourself, to
Right.
help you. You know what I'm saying? To-
So 30 days,
Right.
blackout.
Yes.
Right.
So that's that time that you have for you and God to get, you know, to
Right.
get in the rhythm and get in touch with you and what
And you're
brung
going
you
cold
there.
turkey. You're
Right.
going cold
Right.
turkey.
Right.
So right.
So you need that 30
right.
days.
And you embrace it, because I have embraced mine, and I've never done that before, so I can feel, I feel a difference.
Yeah.
That
Right.
how I, you know, since I've been here, I feel a difference in me, and I'm just so grateful that I'm a part of one day at a time. And I hope that other people come in. We have some good women. We, you know, we enjoy recovery, and I'm learning how to live again, and to be
Now,
a
do you
mother
go to the
again.
groups with Mom Wells on
Yes,
Wednesday
I
morning?
do. I enjoy them.
Man,
She
I got to
encourages
get up in
Yes,
the group.
she's a
But see,
blessing.
I'm a big crier. Okay, I'm a baby. And I'm going to get up in there, and I know it's going to be some tears, and I'm going to be crying and all of that stuff, but I can't wait to do it. And I'm going to do it before the end of the year. I'm going to come in and surprise Mom Wells one morning and just be there with you all. What time does the women's group start on Wednesdays?
9 o'clock.
At 9 a.m.
Right.
every Wednesday. Any woman is welcome.
Welcome, right.
You could
Right.
be a recovering addict or not a recovering addict. You just be somebody who want to come and support some ladies. Come on out to One Day at a Time's headquarters. It's on North Broad Street, right off of Broad and Lehigh, and the exact address is
2432.
2432.
Yes.
North Broad Street. Okay.
Yes.
Okay. Let's see. So recovery, you got the first 30 days when you're on blackout, and anywhere you go, anything you do, you're in the group.
Right. You're
Right.
With the other people you live with. You're
Right.
not by yourself. And that's because some recovering addicts can't be trusted.
Right.
You might get weak.
Right.
You might
Right.
see JoJo down there that you
Right.
know. You
Right.
say, come here, baby. I got
Right.
something for you. You ain't got nothing
Right.
for me
So
but
they keep
trouble.
you-
Bye.
And that's what the
See
30
you,
day.
don't want to be you.
That's
Right.
what the 30-day blackout helps you with. You know,
Getting used to it.
getting to know yourself and getting this information, applying this information, reading the information and applying it to your life, because that's very important.
Okay.
You know what I mean? Because us as addicts don't think rational.
Yeah.
You know, all our thinking is centered around drugs. You know, one more.
So you have groups, sessions 2 3
Yes.
times a day.
Yes,
Right,
we
uh-huh.
stay in group.
We have women's rep. We got the we have some of the we got spirituality group. We got just we have just an open meeting
Yes,
for anybody that
yes,
want to share
yes,
that's in pain
yes.
or something. And I just wanted to thank Reverend Wells and Mel and his wife Tasha for allowing me to come in his house without anything and to be feeling the way I'm feeling today. I just feel grateful for them and the program.
So much.
The
I really
program
do.
is wonderful.
Yeah.
It is.
Well,
Give it
I
a
tell you what,
try.
I know that One Day at a Time is a great program. I believe in it, or else I wouldn't have been serving on the board for 28 years.
Right.
I wouldn't be hanging around like I hang around One Day at a Time. I put my family down. I could cry for One Day at a Time.
Right.
For Thanksgiving every year, where am I? I'm at One Day at a Time, and my family is about up to here, sick of it. Like, they're
Right,
like,
and
come
Thanksgiving-
home.
Thanksgiving
But
they feed.
Thanksgiving and Christmas, I'm at One Day at a Time first,
Right.
and then I come home
Right.
and do my family thing. And family doesn't always get it, but I get it. I know God gets it, and I know that people who are in recovery get it, and so that's why I do what I do. I love both of you ladies. Just met you today. You're
Yeah,
my
right.
sisters.
Thank you.
You're
Thank
my
you.
sisters.
Thank
You're gonna
you.
make
God
it.
bless
You're gonna make it.
Thank
We're
you.
all
Thank you so
gonna make
much.
it. Whatever
Yes.
we decide to do in life. I thank you for sharing your stories,
Yes,
and I
ma'am.
hope that we encourage somebody who is watching the show
Yes.
today. So we thank you for tuning in to this special edition of News You Can Use. I'm your host, Thera Martin Milling, and make sure you check out my radio program at 900 AM WURD, Mondays through Fridays, 6 to 7 a.m. It's the Early Bird Show, but it's a pretty good show. Check it out sometime, won't you please? And watch all the great programs here at LaSalle TV 56. That wraps it up for us and this edition of the show. Check us out next time. We've got more great programming coming your way as we prepare to wind down on the year 2015 and get ready for 2016. Take care, everybody. Have a great day. Remember, life is fragile. Handle it with prayer.